Stephanie, first of all, can I just get a bit of background about what is this Parkinson-specific MER?
The project started with an educational event for pharmacists to learn more about Parkinson's disease. And then we were approached by a pharma company who said, what more can we do? And out of that came an advisory board and a development of a Parkinson-specific medicines use review. That was piloted by 8 pharmacists in northwest London. They'd all had input into the medicines use review content. And the results came back, they were very favourable, not just for the patients but for the pharmacists as well. So last year at the pharmacy show right here, we recruited more people, and with the help of the C&D we recruited more people, LPF networks recruited more people, and phase 2, which is currently running, has 29 active pharmacists from all over the UK who have been accredited to undergo the consultation with their patients. They've got the toolkit, they've watched a webinar explaining how to use the toolkit, and they are all doing these specific Parkinson's MURs.
So you mentioned the pharmacy toolkit you've created. You've did the toolkit and completed sort of training with it. How did you find undertaking that? Because it was how many hours?
It's about 10 hours, and I think I probably spent the full time on it, simply because there's a lot of knowledge to get there, and certainly the point I would make for this, lot to learn to give a good quality MUR, so it's invaluable to do the project toolkit so you can give a good quality MUR.
Beforehand, if MUR had came up, do you think you would have been able to do it well enough to sort of help the patient, or do you think you would have struggled?
I'm sure I would have struggled. In fact, I know I did, because I would talk about the facts of drug side effects, which I knew at a fairly surface level, but you really would struggle with some of the multiple conditions. Was it a side effect? Was it a problem with Parkinson's? So you would have helped as much as you could, but the ones I've done since the training, I'm so much more happy with.
And so where are we on the phase 2 side of things? You've got some feedback so far. Obviously, you're still collating it. Is that correct?
Yes, the evidence is still being collected and analysed, but the overall vision that we're seeing is that everybody is happy with this, even the GPs.
Does that surprise you?
Well, yeah, it does, because, well, I suppose not really, because GPs don't have a good knowledge of Parkinson's. They're not allowed to change or amend medication for Parkinson's. That can only be done by the specialist. But they are welcoming the help that we are giving. So I think 65% of GPs were favourable of what we're doing, and I think Chris can actually fill you in a bit more on that, because he's now being asked to review patients.
So Chris, that's the case. You've been speaking to your GPs and they've been saying similar things?
Yeah. The local GPs in our part of the world, in Melksham, have found it very useful to be able to push patients in our direction, simply to make sure that we've got timings right, that we've got regimes right. There's quite lengthy waiting lists for specialist appointments, and there's a lot we can do in the meanwhile to make sure that, you know, is the dose correct? Could we add dispersible drugs in? Things that the GPs are quite happy to consider, or do we just need to treat some of the side effects better? Or is it time to refer back to the specialists with suitable insistence about speed?
So Christopher just mentioned referring back to the specialist. What other sort of interventions have happened through these here Parkinson's specific MERs?
Well, there were a couple of cases of patients with a dry mouth being prescribed pastils or sprays. There was one patient with low blood pressure who had their medicines reviewed and no longer have dizzy spells, which is if you're not good on your feet anyway and you've not got good balance or movement, you don't want to be dizzy as well. Just really quite obvious things that you would expect, the patients would be able, or GPs would be able to support their patients with, but they were being overlooked. And until you sit down in a conversation with the patient and ask them what their problems are, which no GP has got time to do really, you just don't know what difficulties they're experiencing. And of course, Parkinson's UK are very, very supportive for patients. So highlighting their service and signposting patients to the support that they can give is also a must, because they offer lots of support.
So what's next for the service?
Right. Well, I mean, my dream is to have, as you have Parkinson's nurses who are specialists, to have Parkinson's pharmacists who are specialists. We can't possibly expect for every single pharmacist to upskill themselves and be experts in Parkinson's disease. But we could have a cohort of trained pharmacists who could step in where there is a lack of a Parkinson's nurse, and they could visit pharmacies and carry out the consultations with Parkinson's patients. If it's all booked and organised, it could be a really good intervention service. We're hoping the PSNC are going to support this as a new service and drive it forward for us. They've collected all the data on their farm outcomes website, which has been really helpful, and we hope that it won't stop here. We want to take it to phase 3. I think also to look at pharmacists in care homes, pharmacists that take care of elderly people, and GP practice pharmacists who maybe are reviewing patients' medication, will be seeing Parkinson's patients as well.
I'm really excited to see what it holds in the future, but thank you very much, Stephanie, and thank you, Christopher, for your time today.